welcome back to Nurse Talk. Here on Nurse Talk, we like to talk about nursing trending topics. So if that is something you're interested in, go ahead and like our video and subscribe so you can keep up with our content.
Yep. And today we are talking to you about allergies versus COVID versus the common cold versus the flu. Okay,
Right.
What is the difference between all of them? We're going to go through all the symptoms, all the treatments you can do. But first, remember, we are nurses. However, we are not your nurse. So make sure you follow up with your primary care practitioner and find out what you need to be doing. So with all that said, let's get into it.
All right, so first and foremost, we want to start off with allergies. Everybody is walking around this cold and flu season saying they have allergies, and you do not, sis. But if you do, this is what you may be experiencing. So with allergies, you'll have some sneezing going on. You may experience a headache, but you'll really be feeling that itchy, runny nose and the itchy, watery eyes. That's the key word there, itchy. If you've had allergies before, you know what this feels like. With allergies, they are more of a sudden onset. So with allergies, you experience them more suddenly. So really, you'll experience something that prompts this allergic reaction to happen where you'll feel all these symptoms. Now, with the allergies, how are we going to treat them?
So with allergies, we're treating with antihistamines. This could be your Benadryls, your Claritin, Allegra, Zyrtec. Zyrtec. There's plenty of options out there. So whatever fits your need and, a wakefulness. And then also there's Tylenol for headaches.
Right.
And that's how we're addressing that.
So that's for your allergies. Now as for your colds. Your cold symptoms, you'll be experiencing a cough, maybe some sneezing going on. You may even have a headache as well. Sore throat, you'll have those watery eyes, runny nose, or you may even have a stuffy nose. And you may be experiencing like some light body aches. Nothing too crazy, but you'll feel a little achy, a little sore. Now with that, we suggest treating it with...
So we're going to treat the symptoms, okay? So if you have a cough, we're looking at Robitussin or some other type of cough medicine that would work for you. Headaches, again, we're looking at some Tylenol. Sore throat, we can do a few things. There's a chloroseptic spray. There's also cough drops, warm salt water gargle. And then also you could use raw honey to address the sore throat. Something that does feel nice and kind of helps break up congestion is Vicks Vapor Rub. We all know that our parents used to love rubbing us down and then use as directed though. Also, you could use a humidifier sometimes with the dry air, especially during this season. It, gets a little dry, so use the humidifier. That helps a lot.
Also, during this time, you really want to be increasing your fluids too.
Oh, yeah.
So make sure that if you're able to eat something. If not, just make sure you're just continuing to drink, whether it's tea or water. But you really want to give your body enough hydration during the process of getting better.
Right. Don't starve your body. And then also you want to make sure you stay away from others. Everybody acts like this is something new with COVID to stay away. No.
If you have a cold, you should also be staying away from people. Even not confirmed to be COVID or flu, you're sick.
Right.
You are
still sick. You are still contagious for 4 to 10 days.
Right.
Okay?
So stay away from healthy people.
Right. Exactly.
So that's it for the cold. Now, if you're experiencing the flu, you may be experiencing some fever, some coughing. You may have a sore throat, but really, you may even have a runny or stuffy nose, but really you'll be feeling that fatigue and those body aches. Like with the flu, you really feel run all the way down. So with that, normally it will last anywhere between 5 to 7 days. But our suggested treatment is similar to the ones that we mentioned with the cold.
Right. So we're looking again, Robitussin, Tylenol, for the sore throat, all the things we talked about, the chloroseptic spray, honey, the salt water gargle, cough drops, things of that nature. Then also you want to keep up your fluids. You can use the humidifier, the Vicks Vapor Rub as well. And rest is big with the flu just because you're trying to, get your body back to its norm, okay? Give your body rest. It helps fight infections.
Oh, is that?
Oh, and again, stay away from people.
Yes.
If you do have to go out, you can put on a mask, guys. Like, it's not,
it's
put
not
on a mask.
mandated, but let's be nice to our neighbors,
Right.
and not get them sick.
Exactly.
Now with COVID, so we talked about the flu. So now with COVID, you may be feeling the fever, you may be feeling the cough, and even that feeling of being run down. But the biggest one is you will start to feel short of breath. You will feel like you can't catch your breath, like it's like, the room is closing in on you and you just can't breathe, right? Or if you're walking, right, and normally you walk just fine, it's just takes you a longer time to kind of recover from that. That's when you kind of know you have COVID. And with that, we're treating it with
with the same similar things. Okay, so again, we're getting our rest. We're making sure that we're hydrated. And then for the fever, we can treat with Tylenol or ibuprofen. NSAIDs do bring down fever. Aspirin does not. I know that that's sometimes a confusion. You can use cough medicine, so your Robitussin again. And then also with COVID, when you're dealing with any type of respiratory issues, you want to make sure that you're monitoring what your oxygen saturation is. So you can do that by purchasing a pulse ox. We'll put a picture in here for you. A pulse ox basically tells you how much oxygen is in your bloodstream. So that's important. We want to make sure it's above 90% at least. And also a thermometer, because we want to keep track of how high our temperature is getting.
Your temperature is getting high. You're continuously sustaining above 100s. The Tylenol and the ibuprofen that you've been taking isn't bringing your temperature down. We would advise seeking some additional
medical advice.
Yeah. Again, with everything that we discussed, we would like you to follow up with your primary care physician, whether it's even giving them a call in, letting them know how you're feeling, or even going to visit. But this is just our advice.
And then also with any type of respiratory issues, if you start to struggle, make sure you're calling 911. Okay,
Right.
This isn't a time to play Russian roulette with it. Go to the hospital, because it could be a sign of something more severe.
Right.
So those are our recommendations. And again, we're not your nurses. So you may have noticed that we did not mention antibiotics as any treatment in any of these things, because they're all viruses, well, except for allergies. But allergies doesn't warrant any type of antibiotic either. So I say all this to say that I see a lot of people that want to be prescribed antibiotics during this season. However, they are not necessary, okay? Just doing those things will help you. Antibiotics, overtaking them, actually leads to your body not being able to fight infections later on, because they've gotten used to all the antibiotics you've thrown into your body.
Right.
So
anybody with the old penicillin, moxicillin, augmentin, don't go taking your own old antibiotics. Don't take anybody else's antibiotics. That is not going to help you during this time. Really some R&R, rest and relaxation, some fluids, and a lot of the over-counter meds that we discussed is really what's going to help you feel a lot better.
Exactly. So if you like this video,
like
this video, and make sure you subscribe and share this content, and
come back and check us out.
Yeah, basically.
All right, guys. We're out.
All right, bye.